Can you hear? Hello everybody, welcome to SCIE's Breaking Down the Barriers to Co-Production Week webinar. This is the second webinar. The first one went well, so hopefully this one will go well as well. So my name's Pete Fleischman. I'm Head of Co-Production at the Social Care Institute for Excellence, and with me here are my colleagues.
Kevin Minier.
Do you want to say a tiny bit about yourself?
Yeah, glad to. I'm a care representative. Dad and I looked after my mother for over 25 years, predominantly at home. She had dementia, and I've been a member of the SCIE Co-Production Network for about 5 years now.
Thank you, Kevin.
Tina Colden, I come from a mental health user background, and I'm also chair of Involve for my sins. So a big shout out to the co-producing research How Do We Do It gang, who I was with this morning. Hashtag How to Co-Pro. We're going to hashtag.
Right.
So, and obviously I've been associated with SCIE for many years, so it's really great to be here on the webinar.
Okay, thank you both. And I should also mention my background is also having experience of using mental health services, and that's how I got into this kind of work in the long distant past. So we also have Steve here to help us run the technology and to help with questions. So on your screen there's a chat screen where you can talk to each other and comment and contribute as we go along, which I can see a lot of you have already started doing that. And then at various points you'll have the chance to vote on various questions that we put to you in polls, and we're just going to do a test poll just to get you started, just to see if it's working. So here comes a question. It's going to get a bit bigger, I think. Is it, Steve? And the question is, will England beat Sweden on Saturday? So if you... Oh, I don't think he's launched it.
Yeah.
Yeah. Okay, now you can vote. So... Oh! Oh, there's some cynics among you.
Oh dear, I hope there's not any Swedish colleagues webinaring in. This could be it. There could be some Swedish colleagues here.
Okay, looks like pretty much everybody's voted who's going to vote there. So we've got 81% saying yes.
Let's hope it's true.
Okay, that's good. Power of positive thinking.
Yeah. Oh, so can I get the mouse back, Steve?
There we are.
Thanks, okay. Right, so to continue. So the aim of the session is to identify some of the main barriers to co-production, discuss the possible solutions, and also to receive your views on some key questions. So, what we're going to do with your comments is it's going to inform a short SCIE report, which we'll publish in the autumn. It'll help us shape our big lottery application and also focus our co-production training and consultancies. So what's going to happen next is that Kevin is going to talk just a little bit about what co-production is and some of the SCIE principles of co-production. Then we're going to do 6 polls to get some of your views before we start talking, and then Tina and I are going to talk about 7 barriers to co-production and think about some of the solutions as well. And then at the end there'll be 2 final polls. So over to you, Kevin.
Thanks very much, Pete. Hi everyone, welcome. Hope you're all enjoying Co-Production Week. So what is co-production? Well, nothing about us without us, and I don't think as many people would sort of disagree with that. Why would you want anything without your involvement and your ability to say what it should look like, what you need, and how it should be provided? So that's our key message there. But what does that really mean? So, well, who are people who use services and carers? Well, people who use services and carers working with professionals in equal partnership towards shared goals. And again, I think it's very important to recognise that it is shared goals. We recognise that people who deliver services have their own requirements and their needs as well, and it isn't, it doesn't work just to have one viewpoint in anything. to do that. We need to have all the stakeholders, everybody involved, but working equally so that we can truly have a shared voice and the ability to affect decisions and affect the way that things are delivered. So how does SCIE define this? SCIE defines people who use services as people who require long-term support from social and healthcare services. This includes people who need or are likely to need services but are not currently using them. And we've had a number of consultations where I live through the NHS, and we've been making a bigger and bigger point that a public consultation involves people that may not be using services yet, not just those that are already requiring those services. Carers. Carers are people who provide unpaid support for others who could not manage without this help. They are usually family members and partners, but can also be neighbours or close friends or the person they support. And as we know, many carers now are like sandwich carers. They have elderly relatives that are doing it as well as children. And should we say the landscape of caring for informal carers is getting much, much more complicated and much more demanding. So equality with power sharing, and again it's a difficult concept maybe to get that when you've got. I was reading something today about the legality and the legal requirements of, say, someone like the Care Quality Commission to do things. How do you ensure that equality is power sharing in the right amount at the right time so that it can affect change and the way that services are delivered? And of course, diversity. Everybody has a different viewpoint. So how do we make sure that we understand and comprehend those? It is difficult to understand maybe somebody. It's difficult to live in someone else's shoes. So we do need to ensure that we have access to those and people can contribute there. We were looking at seldom heard voices as well at the co-production festival there, and the fact that it is seldom heard. They're not hard to reach. We just need to make more activity to speak to them. Accessibility. Accessibility isn't just maybe the physical side of it, which is what a lot of times we can limit this to. So it's not just about the physical access, such as lifts, sign language and parking, but it's also about how we communicate and behave. Carefully considering access is a very important part of co-production. If an event or activity is not accessible, disabled or older people in particular simply will not be able to take part. Reciprocity. I've been practicing. I managed to say that correctly that time. If you put something in, you get something out. And for different people, it's different things that they're looking to get out of their involvement. I'm sure that everybody wants to see that their voice has been heard and it's been listened to. But we also know that doesn't always mean that it can actually be acted on at a certain time and a certain place. So reciprocity involves thinking about how to reward people for taking part. Sometimes this could be that people gain networks, skills and contacts, plus making sure that their travel and other expenses are paid promptly. But if people are doing an intensive piece of work that involves a lot of commitment, then paying people should be a consideration.
Okay, thank you, Kevin, for that very good summary of SCIE's definition of co-production, and also talking about our 4 principles of co-production, which are equality, diversity, accessibility and reciprocity. So what I'm going to start talking about is some of the barriers to co-production. Before I start on the barriers, I just wanted to just talk about the actual challenge of cultural and institutional change, so how organisations and people change. So as Kevin was saying about nothing about us without us, that not most people these days, and it wasn't always true, but most people wouldn't disagree that co-production is a good thing. However, it's not as widespread as we'd like it to be. So why is that? I think part of the reason for that is that the way that we provide health and social care is a very complex and sometimes bureaucratic system. It's a very spends a lot of money. There's a lot of people involved. There's huge amounts of staff. So it's a complex system. I think also change takes time, and also people are not straightforward always, and so there's a lot of issues around people's attitudes. Like I think one of the people who's made a comment, I think the guy from Malta, is talking about having people, you know, access to a positive attitude.
Absolutely wrong.
So, and I think the other thing to say is that no one organisation or individual or even a government has all the answers, and the only way that we're going to progress with co-production is to co-produce co-production. Everybody needs to work together to make change. So I think starting to talk about the barriers. First barrier, sorry about there's a bit of background noise at the moment. I think it's something in the street actually. But
Yeah, it's a cleaning machine going down the street. It's
Right.
leaving Baker Street in a second.
Okay.
Okay.
So I hope that doesn't disturb you. So the first barrier, I think, is a lack of a shared understanding of what co-production is. So that's made more difficult because there are a lot of different definitions going around of co-production. There's not one single one that everybody uses. So that means there's a bit of confusion about what it means. Although we don't want to define it too tightly because that kind of might stop people doing things and sort of inhibit them. But then on the other hand, there is a danger that if we don't define it well, then if co-production becomes more mainstream, it will inevitably become diluted. And then I think also there's this issue about what qualifies as co-production, and sometimes quite a lot of people say, oh, that sounds familiar. I think I've been doing co-production for a long time, but I just haven't been calling it by that name. Then I think the second barrier is that there's a lack of understanding of good practice in co-production. And actually, speaking of good practice in co-production, we said that we'd do the 6 polls before I started talking about the barriers. So I think we better getting into the polls before I go any further. Actually, sorry about that. So
He's too keen. This is the thing, you see.
yeah. So well, no, yeah.
Okay.
So if we just do the first poll now, we'll catch up with ourselves. So what we're interested to find out is there a generally shared definition of co-production in your organisation or area? So if you could open that, Steve. Okay, so it looks like there's very few people are strongly agreeing that in their organisation. It's just 2 people are saying that there is a generally shared definition in their area. Whereas 43%, 38 people are saying they disagree. Okay. Oh, it's changed. Agree strongly has changed to just 1 person. Okay. But there are 29 people saying they agree that there is one, so that's interesting. Okay, if we end that poll and bring up poll 2. So this next one is, there is a good understanding of good practice in co-production in my organisation or area. Okay, so we've got 46% disagreeing, and again, very few people agreeing that there is a good understanding in their organisation. So if we just bring on the next poll. So this question is, in my area or organisation, professional attitudes are a major barrier to co-production. So this is looking like developing into a bit of an even split, although 35% of people are agreeing that professional attitudes are a barrier, but then 34% disagree. So, interesting result. Handy, we've got pretty much 100 people as well, so it makes the percentages equal to the numbers.
For those of us that are mathematically challenged, yes.
Yeah, so the next poll we'd like you to answer is, if there was a legal duty to co-produce, it would strengthen co-production in my area or organisation. Okay, so we've got fairly strong agreement on that one, I think. Okay, let's say just about everybody's voted on that one. Okay, so the next one. So that's okay. Before read this one out, or just to let people know, it is, in case you're sitting with your with a senior leader, or maybe there's a senior leader on the on the webinar in another room. It is anonymous, so nobody can tell who's voting what, except if they're looking over your shoulder. The next one is, in my area or organisation, senior leaders lead co-production by setting an example. So obviously leadership's an important part of co-production. Okay, so there's obviously some good leaders out there. So 35% are oh no, sorry, they disagree. Yeah. So this.
Agree, disagree, in the middle. So,
yeah. Okay. Okay. So then we've got final poll for this section. So this one is about skills and knowledge of everybody. So in my area or organisation, people have the skills and knowledge to support co-production. So it's a bit of a mixture, that one.
Yeah, it's interesting. There's still a bit of work to do there then.
Yeah, looks like it. Okay, so for the moment that's the end of the polls, so I'm sorry for that, not doing them quite at the right point, especially on the slide about good practice. But so the second barrier that we've identified is a lack of understanding of good practice in co-production. So when we're talking about good practice in co-production, I'm thinking about things like understanding the differences in power between different people who are getting involved in co-production, having accessible and inclusive meetings, having realistic timescales and deadlines, paying people for involvement, involving people as early as possible, having the right training and support available for both staff and people who use services and carers, having some money behind what you're doing, or at least having enough money that it's realistic, and also having a clear understanding of the expectations and also what you're expecting, what roles you're expecting people to take. So then the third barrier is attitudes. I think this has been mentioned already in some of the text, but among users, carers and staff. So most people's training hasn't included very much about co-production, and so people aren't used to it. And also, most training gives professionals the idea that they have to be the expert, that they have to have all the answers, and that can be a big part of professionals' identity because they came into the profession to want to help, want to help people to make them better. But then that can bleed into sort of arrogance amongst some professionals, and sometimes that can be an attitude which is quite defensive about co-production. But equally, people who use services and carers can be quite cynical, or they can be quite sceptical about co-production and sort of say, "Oh, it'll never work. Nobody's ever listened to me," or they're so used to not having their voice heard that even when people are listening, they can't really take that on board. So in a way, everybody is institutionalized to a different degree, and everybody finds it hard to work in a different way when they've built up habits, habitual ways of working. I think there can be, in some organisations, a lack of leadership, and also there can be fear among everybody, really, that things could go wrong if we do things in a different way, and that we do, in some places, have quite a risk-averse culture. And then I think it's also, there's always this thing about the difference in power between people, and getting over that's really such an important part of co-production. So I think the fourth barrier that we've identified is a lack of strong enough policy and legislative levers. So what that really means is there's just not really enough laws about co-production to make it happen, although you need other things to change, but laws can really help. It is good that co-production is defined in the statutory guidance to the 2014 Care Act. That's really important. First time it was defined in law, but it's not the best definition. It's quite a weak definition, but it does give some examples. It's a step forward. But at the moment, there's no duty in law to co-produce. So if you don't co-produce, you can't be sort of inverted commas sued. There's no, organisations don't have to co-produce. And then I think also sometimes, and some people who use services and carers particularly found that CQC inspections don't emphasise co-production strongly enough. Although they're in the key lines of inquiry, the sort of guides that inspectors from CQC follow when they look at measuring how well services are doing, do include some stuff about things like co-production, but I don't think it's clear enough and it's not emphasised as strongly. But CQC are thinking about this, and we had somebody from CQC at our co-production festival, and who they were really talking. Yeah, a couple
of them, and it got mentioned there, didn't it?
Yes.
It was said clearly there with some of the people, and they were going, "Oh, okay, right, yeah." So there was a challenge there to the Care Quality Commission to up their game on inspections around co-production. So they do have co-production work going on.
Yeah,
within
they seem to be doing more and more
internal stuff,
yeah.
And they do involve people in inspections. But I think there's a challenge then that it could be done a lot more strongly. So, and I think that was good because they listened and took that on board. So we shall see.
Okay, so I'm going to hand over to Tina now to talk about a few more barriers and then some of the solutions, and then we can do a couple more polls and then throw it over to discussion. Yeah.
Yeah, good evening. Oh, good afternoon. Well, it depends where you are in the world, I suppose. It could be evening. It's, I have to say this week has been very long, so I'm starting to feel tired. I think all the excitement of CoPro Week. And what's been lovely is it's really galvanised lots of energy amongst people. It's certainly drained my energy, but you know, there's lots of people thinking about co-production, what it is, having these conversations, and trying to think about how we can really make it happen, so that, you know, we are making things better for ordinary folk out there. That's what it's all about. So, you know, coming on to that, there are lots of examples and descriptions of co-production processes now. There is a sort of evidence, there is an evidence base out there, so you just have to look harder for it. And certainly if you look on the SCIE website, we've been collecting and still are collecting and welcome any examples, and we've got blogs and all sorts of things, guidance around co-production as well. So, you know, there are things there. It's just obviously, you know, translating it to where you are perhaps is the issue. Having said that, there's not enough well-designed sort of evaluations. We know it does work because there's anecdotal, there's narrative around there. But sometimes the money people, the numbers people want to be able to prove it through those lenses. So it, you know, we haven't got enough well-designed evaluations from that because it tends to be more qualitative research, which is absolutely lovely. That's the thing that does it for me, is the qualitative research, but not enough quantitative. And also the thing about economic research. People want to know that it's saving money. You know, the NHS is 70 today. Happy birthday, NHS. Happy birthday. Mm-hmm. Also, happy birthday, social care, which is also 70 today, and the quiet twin, really. But I think sometimes with this, the argument gets very boiled down to, you know, how much is it going to save us? How many bed days? How many this, that, you know? And I don't know. It's I think you know, we can start to lose the point of what we're doing here if we keep reducing it down into just money. So, you know, we're looking at quantifying co-production. There are obviously, you know, we can't go on and say, you know, this is a nirvana. There are lots of, you know, pressures on the system. You guys out there, it's great that you've come and joined us, but we know it's not easy. And one of the reasons we're doing these as webinars is to hopefully for people to, you know, who don't have much time, to make this accessible, to be able to join in the conversation, because you're all very busy people. So, you know, that time and people is a big issue, but generally lack of resources, which of course includes money, you know, as well, means that, you know, we're all having to do more, work harder and do more for less, particularly in the voluntary sector. I'll give a shout out to the voluntary sector. And it's sad to see, you know, both, well, Kevin and obviously comes through the carer sort of end, and both Pete and I come from user sort of organisations, and a lot of them have come and gone over the years, and I've done some really good, solid work with, you know, people on the ground, really affecting change for individuals, and it's really frustrating when you see some really good stuff happening, and they're getting closed down or starved of funding because perhaps some of the bigger organisations are getting the work. The smaller ones aren't being helped to be able to bid for work, or they're not being, what they're doing is not being seen as important because the commissioners aren't asking the users and carers what is important to them. They're assuming what is important. So, you know, it's quite complex, really. And obviously, you know, people themselves who use services and people who care for them are under pressure from daily life. And we know from the struggles with just getting into a service, getting something from a service, staying in a service, and also if you're trying to access welfare benefits, that's a big issue. It's been acknowledged. sometimes, you know, people are just fighting to keep their head above water when it comes to daily living, really, coping with whatever their impairment is and hoping to get enough support and help for themselves. And actually it's quite a battle for them, so they don't have enough time or capacity to you know, to get involved in stuff sometimes, and you have to respect that, and be, you know, realistic. And the other thing about realism is timescales, and this has been said in your chat, that sometimes we just want everything done very quickly, instant whip. So he ends up being you consulting with people, possibly even asking him about something where you've already got the answer. And you know, this is not co-production. So one of these things you need to think about are the you know, time scales and the realism around that. Can you really build in enough time to really involve people properly so that you can co-produce your project or your research or what have you? As Pete said earlier, you know, although co-production's been around for years, it's gaining currency, and it's so fantastic that Co-Production Week is something that SCIE started off, and it's really caught hold all over the place, and it's challenging everybody to think about how we can do co-production better where we are. And there's still a lack of, you know, training around, obviously, in professional skills training. So certainly young professionals coming into universities and out, they might be getting a taste a little bit now, because those of us are there are shouting loudly, but also when you're in organisations, it's you know, there's not enough help, and obviously training is one of the things that goes by the by, sadly, when you're in a very busy organisation. So we're very aware that certainly at SCIE, that if we can help with your training needs, we can do that in a flexible way, and that's why we're trying to do some of this stuff through webinars, just to give people a shot at this stuff, you know. Professionals may also lack confidence and skills. You know, sometimes you are taking people out of their comfort base. They are good at doing what they do, but not everybody's good at doing everything, and this sometimes can feel a bit scary. It is stepping into the unknown, so you know, it's easier perhaps not to do it than actually do it. And on the other side of that is users and carers may also lack the confidence and skills, which means that we really do need to think about, when we're thinking about co-production, about the people that need to be there are the relevant people. But if they do lack confidence and skills, how can we help them be there? How can we help them stay there? What are the skills that we can help build up into them? But also not ignoring the skills they already have that they bring from their everyday life. So, you know, it is very much about a journey together, because it takes time and effort to change behaviour. It's not instant whip. You know, there's not two ingredients you suddenly mix up and you've got this extraordinary thing called co-production. It is about hearts and minds, and it is about relationships, and it is about building trust and relationships, and then working on the issues together. And that takes a bit of time. So, you know, sometimes that's why, you know, this stuff doesn't happen very well, because people shy away from that, and they just want the easy, quick answer. But the easy, quick answer isn't always the best one. Okay, so some solutions for you. Obviously, training and support. SCIE can offer you some of that. Go on our website and have a look and see what's there to grab free. We also do other training, and can do training and bespoke sessions. But, you know, there's more people doing co-production and talking more, networking around this. We've got more research happening. Certainly the National Institute for Health Research through Involve are championing co-production in research, so you can start to look at what that looks like. And again, that's a journey where we're exploring what co-production looks like in research. So, but also researching co-productively, you know, it's a method so that we can build up that knowledge base to be able to say you really do need to, you know, work with people co-producing research all the way through to see that you get a better better research design and better end products, better outputs. There are more evaluations, so less the sort of heavy academic sort of, but very much important sort of evaluations of things that are going on. And if those things are co-produced, you're making sure that you're asking the right questions from everybody. Obviously, a legislation, we've mentioned that earlier. Is it a stick or is it a carrot? Is it going about too far, or as somebody said earlier in the chat, if you legislate, will people just do the minimum and then saying we're doing it rather than going further? So there's always a debate around whether we can push for this to be a legal entity, and those of us who've been around far too long in user and carer involvement know that our rights have strengthened over the years through legislation, but it's been a long and hard fought battle, and there's still paid lip service for some of the stuff that's is legislated for. So it isn't a cure-all for everything. So it might be one of the things that can help. We mentioned earlier about leadership. It is so important for senior leaders to buy into this, to believe it, and to prioritise, because the people in a hierarchy, the people underneath them, will just choose not to do it otherwise, and you're not going to get that whole systems approach, you're not going to get the culture within an organisation. And I'm so glad with my association at SCIE. I can remember when we started talking about can we do it at SCIE, this thing about co-production. It was a challenge to this organisation, which had been doing very good involvement, and it was about challenging ourselves and taking
it's an ongoing challenge, really, challenge.
And it's not something that I think ever get to. There's a nirvana where I think it's constantly reflecting on your practice and how we do things. And when I say you, I mean workers, but also your users and carers. That's the whole point. You can reflect as a whole sort of organism rather than an organisation to think about it. So, but leadership is very important, and just sharing what works. Again, the website, our SCIE website, has got lots of good examples. Please, tell us about yours. And I think it's really important. People want to see sometimes solid examples because they can't visualise it from where they are. So they need something to hang on to. They need to be convinced. So it's good to have good learning and good practice to share. And again, it's about challenging us and thinking is this co-production, and how does it work in different settings. It is that journey.
So just one more slide, and then we're going to do some polls.
Mm-hmm. One thing that we came up with a while ago was the jigsaw model. Right, sounded like muddle there. Could be muddle. Model, a whole systems approach to the co-production. This came out of a particular piece of work, and again you can find it on our website. But if you look at it, it's a nice graphic. You're just thinking about if you get structural things in place, you can infect the culture of the organisation, you start practicing what you preach, and then there's that thing about reflective practice, about reviewing what you're doing and making sure that you can improve, which feeds back into the structure and again infects the culture. So that's why it's called the jigsaw. Those things interlink. They're very important. You can't have one without the other. So it's as I say, it's a whole systems approach as a way of for you maybe thinking about what does it need to look like in my organisation. If you perhaps break it down into those 4 areas, that might help. That might help you in terms of thinking about what co-production.
Okay, thanks, Tina. So we've got 20 more minutes to go. So we're just going to do 2 more polls, and then we've got a few more sort of informative slides, and then we can throw it open. So Steve's just coming over to get some polls onto the screen. So, what we want you to say here is, what do you think out of these things would strengthen co-production the most? So, better funding for user and carer-led organisations, a new duty to co-produce, more evidence of what works, more leadership from senior managers. Okay, so there's a nice evenish spread there. New duty to co-produce, not so popular. But there's definitely a lot of support for more evidence about what works and more leadership from senior managers. Okay, thank you for that one. So, poll 8. So this is just trying to help SCIE think about what we can do, although we can't do everything. It's everybody's responsibility. What is the most important thing that SCIE can do to strengthen co-production?
Because we're very much on this journey, but we're learning, so we're prepared to share that with you and work with you. What would that look like?
So lots of support for developing practical guides. And bringing evidence together.
Yeah, makes a lot of sense.
Poor old co-production week's not high on anyone's agenda.
Oh dear, we're having a fantastic time. I'm actually exhausted. We've had a great time nipping about. But I think it's. I'd vote for that. Somebody did.
No, they didn't.
Nearly, and they went.
Okay, thanks for that. So I think we've just got a few more things to say, just that we've got more examples of co-production on our blog spot, and we've also got practice examples on our website, and those practice examples are part of our guide to co-production, what is it and how to do it, which has got a lot of information in it, and it's also got, I think earlier people were asking about quantitative research and evidence, and there's a section about evidence and the economic arguments as well in there. Then a short commercial break. SCIE offers training and consultancy. We're running a couple of courses in the office that are very, they're only £150 I think per person. One on advanced skills and one on paying people who receive benefits. And then we also offer more bespoke in-house training consultancy that we can do in your in a venue of your choice.
Yeah, there was a question much earlier on from Zoe Jones. Hi Zoe, how do we pay people without affecting their benefits? Do look at the SCIE website, because we have some information there. I would say this, wouldn't I, but actually the course that we do, we in Judy Stott, who's a tenacious advocate for making sure that people get what they're entitled to, and what she doesn't know about the benefits system and how to challenge it, it's not worth knowing, to be honest. So it's always a very worthwhile course in terms of helping understand and it is a tricky landscape to navigate. So if it's research you're doing, pure research, you can go on the involve.org.uk website, and there's some guidance there that lots of people out with research also use about how we can involve people and make sure that they are recompensed properly when it comes to them being on benefits. There's no excuse for not valuing people It's really important that, you know, because people have got skills and experiences that they're willing to give and share, and we need to value that, and also make sure that we take care of them, and make sure that we don't obviously mess up their benefits. That's the least we can do.
There's a question from Fiona Smith about support with the challenges of managing different expectations. Well, the Advanced Skills Training course is very much a participatory course, which what we're planning to do is kind of model it on a co-production approach. So we're asking people who are coming to the course to bring some issues with them, and then we're all going to try and use our collective kind of knowledge and understanding to help try and work on some of those issues, rather than thinking there's some way that sort of like that trainer from SCIE has all the answers. But I think what I'd like to do is, well, Kevin, have you spotted any sort of themes that have been coming out from all the comments?
Yeah, I think so. I mean, I was interested in the ones on research because I've sort of started moving in a bit more into that area after doing some of the guidelines, the health and the social care ones, and seeing, well, to some degree, the lack of, and also the quality of that evidence that comes through. But one other thing I found out was that I think is that quite often with the things we're looking at, people think it's all qualitative. It's got to be qualitative because it's about service user experience and care experience. But the industry I worked in, I find it not too difficult to find out with measurable things that actually prove that this has worked. That people are able to do things that they couldn't do before, that they're able, without even the social sort of model of actually quality of life, but actually evidence that people are doing things that they weren't doing before because they've had access to better services. And people were asking about that, do you have some examples of co-production in quantitative research? Because I think that is right, as Tina mentions as well there. The other thing was interesting, someone said about self-awareness, and we've done unconscious bias training here at SCIE, and it was beneficial to everybody. It really was, the staff, and also people you thought, well, maybe being, should we say, subject to bias, a lot of that, but even they found out that there were areas where they could develop and grow in that. And I think it came up in my group, the workshop yesterday was about honesty and trust, and integrity was a word that somebody used here, and there is definitely a need for that, the cards are on the table, basically. There's nothing, things are not hidden behind.
Yeah.
And I suppose my last one for now anyway is that people are asking about different types of co-production. But I think what they were really referring to is how much has been implemented in true co-production. Pete was saying again at the question and answer, the panel there, about how it's important to, all these parts are important, and being involved right from the beginning to the end are important. But again, as someone said, what's the difference between consultation and co-production? We know it's a lot, but if people are using consultation as their co-production model, then they should be able to see that it doesn't work, basically. It achieves very little in that aspect. So, and people do want to implement a piece of the jigsaw, don't they? Because that's the way we operate in the world. But, what bits are going to be most effective? And of course, from that, what's most effective for the organisation? But do the users and the carers actually think it's most effective as well?
Yeah.
Because they may have a different opinion about that as to how it is. So lots of research questions.
Yeah. I think that's a key point, because we still think from service land sometimes. And it's not surprising, people are managers in organisations, and they think or look through that lens, through that prism. And actually, that's why you involve users and carers, because they will give you a completely different insight into really what matters for them. And often, we'll come up with the answers, and it's not necessarily going to cost much. As the point there that Peter's made, local authorities do grasp the importance, but are struggling with savings imposed by central government. Yes, I'm not sure where those savings are going. Well, perhaps as a non-political organisation, we won't go there. But I think there is. Yes, I think the social care sector has been starved of money. And it's really ironic at the same time where we're also saying, hey, let's do co-production, when there's not much given the system. In terms of resources, as we talked, people, time, money. And that can obviously affect some of the goodwill as well. It's I think we are realistic about this, but hopeful, because one of the things is we've been doing stuff for years in certain ways and people haven't appreciated it. So, or it hasn't worked for them. So it's pointless wasting money in that. It's important that we do have the opportunity to explore things differently.
I spotted a comment earlier about personalisation and co-production and what was the difference, and I just wanted to say a few words about that, because I think they're related but they are different, and I think personalisation is much more about an individual service, getting a service that suits them personally and is person-centred and is formed around their needs rather than the needs of the service, whereas I see co-production as something that's more strategic, and it's more about groups of people getting together and shaping what's available rather than trying to find the right service just for an individual. So they're very closely related, but I think that's the kind of a difference.
Yes, I mean, the idea of co-production came from working with neighbourhoods, with people and groups of people where they are. So yeah, there's certainly a lot of crossover. You do hear people talking about co-producing your care plan, which I think is quite interesting. But okay, as long as that happens and they deliver on your care plan, that in the real world would be rather nice. So, but I agree. Yeah, there is a lot of synergy between co-production and personalisation. But personalisation is, very much about to the individual. Saying what is it that we think that, or you think that is going to help you. And very often, that feeds into co-production, because if there's something missing in the that is a support thing in your community, that might be the thing that needs to be commissioned on a bigger scale for more people. So it's there's a definite interlink there.
So some people have been talking about ladders of co-production and involvement. So there's the famous ladder Arnstein's ladder, which is 1969 or 68, I think it might have been. But there's been loads of different ladders, and if you Google ladders of participation and ladders of co-production, you see literally hundreds of them. But I think the thing about ladders are that they're useful for working out, maybe like doing a sort of quick self-audit, working out where you are on the ladder. But they don't help getting up the ladder, and that's what I think the advantage of the jigsaw that we showed you earlier is. It's sort of that's getting you or people to sort of really think about what needs to change in an organisation to actually move it to a more co-productive way of
things that are there rather than this sort of linear up or down.
Yeah.
I think that the blog we had on Co-Production Week was also good about that, sort of saying that you should start at the top and then justify why you're further down for a specific project or a specific activity.
Yeah.
So the default should be as co-productive as possible, and then justify why not.
Yeah, and it may well be that you only have to consult on something. That is entirely a reasonable thing to do. We're not saying consultation is the bad boy in all of this, but that's one way of asking a question. But this is a whole way of working with people, and consultation is one of those tools in the toolbox.
Yeah.
So Kevin's absolutely right. If we start thinking from a different place and then thinking about, why do we do it this way? What is the most appropriate way to get to the bottom of this issue?
Yeah, we've got a point about building in co-production into commissioning from I think it's Vicky Thompson too, which I think is a very good suggestion. I mean, we really need to embed co-production in a variety of points within an organisation or a care or health system. And then somebody else was thinking, could SCIE have a focus group about getting a definition of co-production? That's an interesting suggestion, but
suggestion.
We might think we think about it. We certainly, one thing that I would like to do some work on is, like, some people seem to do co-production, and it seems to come to them naturally. And whatever the constraints or the sort of context that they find themselves in, they always seem to be able to get people involved in an equal way and do something that looks like real co-production. So what are these people doing that other people don't seem to be able to do so easily, and could we kind of somehow work out what that was?
Yeah.
I think some of that comes back to what was mentioned earlier by one of our colleagues in the chat room there, was saying about positive attitude. I think, you know, it does make such a big difference. As a practicing depressive, I'm challenged myself every day on this, but it is that thing that, you know, when you can go into an organisation that ostensibly is the same, and yet it feels differently because there's a good attitude, so the leadership, but also the culture of everybody there is saying, yes, let's make this happen, and you can do a lot to overcome issues by having a good attitude about it.
I mean, one of the things that was raised at the Co-Production Festival there, and it's also come up here in places, that, you know, people who attend the Co-Production Week know about co-production. People on this webinar know about co-production, and it is important to spread it and share it to everybody that can do that. So we do want to do that, and of course find a way to actually share that and spread the word about co-production and what it is and how to do it, so that many people, you know, that will know when they're being engaged and being involved in co-production, and when they're not, and when they're not.
Yeah.
Okay, we've just got a few more minutes left, so we're getting to the end. Quite a few people have been asking about whether the slides will be available. So yes, we are going to make the slides available, and there'll also be a recording on the website. And I think we're also going to try to make some of the links available from this session and from the one earlier in the week, but that might take us a little bit of time. But
yeah, I mean, there's been some good chat, and it's lovely because you guys, whilst we've been wibbling on, you've also been talking to yourself amongst yourselves and sharing email addresses and sharing web links, you know, and that's what it's all about. No one person or one organisation has you know, the answer to all this stuff. So it's really, really happy to see that everybody's sort of sharing and talking about this, because it's really, you know, that journey thing again, that we're all on together and we're all learning. So it's a really enjoyable way to spend a Thursday afternoon. Although I think we've got cake outside, so you know,
yeah,
there is always that temptation.
There's a leaving do happening immediately after this, so we have to stop on time because it will get very noisy. I just wanted to mention Jacqueline Jones saying that. No, sorry, it was Joe McIntosh saying about shouldn't partnerships be in the jigsaw model? So I think that's a really interesting point, actually. I mean, the jigsaw model is just looking at a single organisation, but yes, I think forming partnerships with other similar organisations, or maybe with service user or carer-led organisations in the same field, would be a very important part of developing your co-production culture.
Exactly, and Barbara says co-production should benefit all participants, not just service users and beneficiaries. Absolutely, the whole point is about shaping, you know, this came from shaping public services. This is what we're talking about in social care. It's about benefiting everybody. If we get it right, you as workers are going to get much more job satisfaction in what you're doing. So it's really important that you know, it is about that working together to solve issues together.
Okay, thanks for those. Thanks for that last remark, Tim. I think that's going to be. We're just finishing up. I don't know, Kevin, if you want to say anything.
No, I just want to say thank you for all coming, and enjoy the rest of the week.
Yeah, thanks very much. Really lively discussion. We enjoyed it here. So thanks very much for participating.
Yeah, thanks everybody. It's been absolutely great. And keep up the good work. I know it's not easy out there, but it's really brilliant that everybody's taking the time to join us today, and keep on doing what you're doing. It is appreciated.
Thank you.
Bye now.
Thank you. Bye.